At the heart of what we do, we are acting as an ally to families of children with autism in order to create meaningful change in their lives.
Because we are different than a lot of your traditional ABA companies. We use more of a child-led, play-based approach. And so the kids, hopefully, when they come in, just feel like they're playing all day.
We really create a customized, individualized treatment plan for each child that we serve in an integrated fashion. So what that means is that we're working with ABA professionals, board certified behavior analysts, and speech language pathologists in order to craft a treatment plan that is going to leverage the expertise of both domains in order to have a really impactful change in that child's life. We're in a unique position in the life of that family because we are with a child for sometimes 20, 30, 40 hours a week. More so than many other kind of service providers or doctors or psychiatrists, we have a unique position where we get to know the kid really, really well. We take data on all of our sessions. We understand what's going on and how different inputs can affect that child's life, their behavior or mood or things like that. And so we're able to kind of work with other providers in order to, not only refine and improve our program, but help them be more successful in what they're doing. A speech language pathologist might be working on one thing, a BCBA might be working on another. So when you're able to integrate those and have kind of one treatment plan, you're able to make sure all of those different treatment plans align and that they're not contradicting each other. They're not, inadvertently hurting each other and kind of setting back the child's progress. And then from a parent's perspective, it allows the parent to be able to, not have to play telephone between those providers. It's a more streamlined approach for them, logistically and then also clinically.
With each child, there's a lot more opportunities for generalization as well as social opportunities, really encompassing like the whole child and all of their skills, not just does the child know red.
It's so important to be able to generalize those skills, right? So, a kid may work on certain things in our clinic and be able to, demonstrate those skills in our clinic, but that needs to be able to translate to their daily life, right? And, we're with them a good amount of time, but we're not with them all the time. And, to be able to kind of have those skills, generalize and kind of carry out through their life, it's incredibly impactful when parents are able to reinforce those programs and kind of, understand the science of what we do. It's really about taking something that can be really complicated and difficult for families, an autism diagnosis, and really making it as simple as possible, as simple to get that help that they need as quickly as possible.